Well, good afternoon, everyone. Nice to see you all. And I'm so delighted to introduce to you our guest speaker, who was my former student at SIUE, and her name is Jaime Henderson. Jaime graduated from the SIUE speech pathology program in 2015, and then she worked privately for about 2 years. And then she liked the SIUE speech clinic so much, she came back to SIUE as the clinical coordinator of the speech language, hearing center. And being a faculty and the chair of the department for many years in the program, I can tell you what an outstanding work they do, providing speech language, hearing services, both for children and adults. And Jaime's role as a clinical coordinator is to make sure that everything happens in the clinic smoothly, and also supervising the graduate clinicians both on campus and also off campus. So it is a tremendous responsibility, and she does it beautifully. And also I know SIUE Clinic for many years, they got a lot of funding from state of Illinois, but in the last 10 years, not much, as we all know, nothing unusual. So they have made it, as of now, self-sustaining clinic, and they have gone through very rough times over the years. But again, in the last year and a half, with the pandemic, they have adapted well, and they are providing telecare services as well, in the clinic. But again, it is an ongoing challenge, working in the SIUE in a community not able to get sufficient state support, because anything that we do in the speech language hearing clinic is labor extensive and also equipment extensive that needs a lot of help and support. But I applaud Jaime for sticking around the SIUE program all these years and providing a great service. So on that very short note of introduction, so let's kind of welcome Jaime Henderson to the podium. Thank you.
Hello, everyone. It's wonderful to be with you all again. I am one of 3 Jaime Hendersons in town now. There are 3 of us. We're expanding our dynasty. I may be the only one named after the bionic woman, but we'll see. Maybe. All right. Okay, so thank you very much for this opportunity to share about the Speech, Language, and Hearing Center at SIUE. I truly work in a wonderful place with extraordinary people. So thank you again for this chance. I have a few questions for you. This is reading day at SIUE, which means my students have the day off. So you're it. I have to teach somebody something today, right? So you get to be the one. So don't make me call on you. You can call the answers out. And so I apologize to our Zoom audience. In the future, you can do this at home. What do SLPs do anyway? Where can you find one? Hospitals, you can find them at SIUE. That was a gimme, right? Good job. Hospitals, rehab centers, anywhere else? School, private practice. Great, this is a really smart group of people. I always pride myself on surrounding myself with smart people. All right, but what can they do at these places? Any ideas? If one has a lisp, call us, right?
Recover from a stroke.
Recover from a stroke, that's extra credit, good. Swallow study, you might have some inside knowledge there, right? Yeah, swallowing. Does that surprise you that speech pathologists deal with swallowing disorders? Maybe not. Okay. So for the next few slides, I'm just going to scroll through and show you primarily where we can work and what we can do so that you have an idea of what we're training our students to do at SIUE. And then I'll spend most of my time talking about the clinic itself. Okay, so as mentioned, we do work in hospitals. We treat people across the lifespan. We work with people when they first are admitted into an acute care setting, and we might follow a patient even to home health or see people in long-term care or in outpatient rehab. Just another example of SLPs working in the inpatient setting. But we also work here. We're used to working in schools, public and private. We work in early intervention in the home or in daycare setting. We work in private practice and the university clinic, which is where I live most of the time. And I'll give you some more about my experience there. So some of you mentioned what we can do. This is not an extensive, comprehensive list, but it kind of proves my point that the scope of practice is wide and varied. So we work with individuals to diagnose and treat a variety of problems. And we actually can do most of these in our university clinic, with the exception of potentially diagnosing a voice disorder, or certainly a disorder for swallowing, which is dysphagia, which may need some instrumental assessment. Okay, so keep that in mind. We work across the lifespan from birth, newborns, to my favorite population, which is geriatrics. All right, so let's spend some time about talking about our program. Okay. To practice speech-language pathology, you need to have a master's degree from an accredited program. And lucky for us, we have one here in town. Our graduate program at SIUE contains usually 40 to 50 graduate students at one time each year. Most of whom come to us from our own undergraduate program, but we have people come from other undergraduate programs in the country. I think we have one from Ole Miss right now. So graduate students spend 4.5 semesters on campus at our clinic, and then 1.5 semesters off campus at their clinical rotations in the community. And my job is, my wonderful job, is to work with students as they navigate their clinical rotations on campus in our clinic, and also as they move off campus to our community partners in clinical education. So our Speech, Language, and Hearing Center is on first floor Founders Hall. It's newly renovated, so we're happy with that. So I'm going to spend some time talking about our grad students, because our university clinic serves two purposes. First, we need to train clinicians, and we also serve our community members. So we have a twofold mission, if you will. So let's spend some time talking about our students. So I like to use a lot of pictures, right? Pictures can say 1,000 words. So here are some of our students. They spend their first few semesters with us treating clients in our clinic, and they usually see typically 2 clients each semester while taking full graduate coursework as well. So here we are with any particular course. We love to have a lot of fun. Our cohort is small but mighty. Again, it's a small cohort, but they become quite close in their clinical work on campus. Again, our on-campus clinic is in Founders Hall, so I have some pictures of clinicians in our space. We have a large work room. We have 9 clinic rooms. We have a materials room as well. So these are just a few photos of our clinicians in our on-campus clinic. So after being with us, in our on-campus clinic is where students first practice speech-language pathology while taking graduate coursework. So after they transition, after 3 semesters in our clinic, they take additional coursework, and then they fly the nest to externships. Out into the community they go. And so I wanted to show some examples of our clinicians, our graduate clinicians, out in their community rotations. Remember, they have to have a variety of experiences. You saw that list, right, of our scope of practice. It's wide and varied. So our practice and training for these clinicians, that needs to be wide and varied too. Trust me, You do not want anything but a well-trained SLP at your hospital bedside or working with a loved one in schools or in any of the places that we've showed before. So you see a couple of our grad clinicians. The one on the far left for you is a clinician at the Rehab Institute of St. Louis, working at a brain injury awareness event. The one in the middle is a grad student off at her school-based rotation at the special school district in St. Louis. And then the one to the far right is a grad clinician over at Christian Hospital Northeast for her medical rotation. So our clinicians during their second year have 3 clinical rotations. They're full-time, they're roughly 9 weeks, and they go to 3 different settings. Okay, so let's move to our clients and focus on them. So our first year grad clinicians, they're doing great things at our clinic. And before I leave, I actually would like for Dr. Parker, if you don't mind, to pass out some flyers to give you more specifics about our services that we offer at the clinic. You can find more information about our service delivery model and some specifics for enrollment. So I'm just going to scroll through so you can see some of our clients and clinicians in action in our treatment rooms in the center. You can see we have a lot of fun. Over to your left is actually at the top a screenshot of a telepractice session that we needed to do during last fall to provide services for our clients who weren't able to come to campus. And so you see a supervisor there who's looking really happy, and then 2 graduate clinicians working with that equally happy customer, whom I believe is Captain America. And of course, we always love our graduates as well. Our graduates, they've achieved their goals. They've achieved their communication goals, and we celebrate them with a lot of pomp and circumstance, as you can see there. Okay, so far I've been talking a lot about our inward focus on giving our students varied experiences and focusing on their clinical training in-house, and our clients receiving speech and language services in-house. But we also look outward to our community. We do a lot of community outreach regarding screening events. And so screening our events they're designed to identify people who may have a communication disorder. So those screening events refer people to professionals for further evaluation and potentially a course of treatment if they need it. So you see here, we're doing some speech and language screening on campus at the Early Childhood Center. If you've never gone there, it is a magical place to just sit in the corner and hang out. So we do speech, language, and hearing screenings there on campus. We offer screening events in our clinic space as well. But this is a wonderful opportunity for our graduate clinicians to go out and work with the public, work with the general public, and get some experience that way as well. We spend time advertising ways we can support individuals who live with disabilities in our community. We provide information, education on social media platforms as well, as you can see to the left there. So for community outreach, you might notice a particular character in the far right picture there, a celebrity to say the least, right? So we do hearing screenings as well on campus, or we partner with our local wonderful audiologists for the opportunity for our speech and language graduate clinicians to go and do screenings in the community at a health fair, a public place like a library or a private school. So those are the types of places we've done hearing screenings in the community. And so this is part of clinical training, and we also need equipment and materials to be able to carry these screenings on a regular basis to offer those to people who really rely on these screening events. They may not be able to be refer to appropriate professionals, and get the services they need as quickly if it weren't for routine screening events that we offer free to the community. And of course, it's also part of our clinical training for our graduate clinicians. Okay, so I did want to give some examples of clinic feedback. We always strive to get better at what we do. And so we seek and we welcome feedback from community partners, as well as for our families, our clinic client families who come to us for services. Sometimes people come to us as their sole source of speech and language treatment. Other times people supplement their therapy they're receiving elsewhere. They come to us for additional treatment. And with permission, we collaborate with other treating clinicians as well. We offer 100 minutes of speech and language therapy service each week, and that's significant. And we do that at a reduced cost, which is a huge benefit to people who that really matters in our community. It matters to have that lower cost for our services. So even with this being a teaching clinic, a university clinic, our grad students are always supervised in real time by licensed providers who are trained in clinical education and also have experience being practitioners themselves. And so they work with grad students to provide these services to the community. That means that people who come to us should expect adequate, appropriate services for what they signed up for what their enrollment is. So they've signed up for these services, they see progress, even working with student clinicians. And so I wanted to put up some testimonials for you to see. Something that's unique about a university clinic is that we use live video recordings into our session rooms. And so parents and caregivers, other stakeholders can actually watch sessions as they're going on. And so for one family, that really meant the ability to carry over some of the strategies that the client was working on in the session to the home. So our ability to do that was important. Okay, so as Dr. Partha alluded to, we've had to adapt, like many people, everyone had to adapt last year for service provision to our clients to avoid a long interruption of services or the inability to meet the needs of our students as they matriculated through our program. We adapted to provide telepractice when it was impossible for people to come to campus. And that's not something you just flip a switch for. It takes a lot of hardworking people working together to train students to be able to do that. But that has been a really wonderful opportunity. And those clinicians who had that ability to practice with us now have experience in telepractice for their professional lives. When they graduate from us, they go to become clinical fellows out in the community. And so they've had that opportunity to learn at our clinic as well. We are seeing people in person now, but we also have the capability now to provide telepractice on a case-by-case basis. So we do welcome any opportunity to join with us in making this impact on students and on the community. Any proceeds that come to our foundation go directly towards client tuition scholarships. I mentioned that our fee is significantly reduced from what you might see in a private practice, that cost. However, it is still a barrier to some people in our community. And it's been wonderful to be able to offer tuition scholarships to individuals or families in the past who we provided a much needed service for treating communication disorder, and ultimately led to an improved quality of life for that person. That's what we do. That's at the heart of what we do. We also have equipment and materials that need to be maintained each year to make sure that we're meeting the needs of our students in the community. And so if you are so moved, it would be wonderful if you would like to join with us in supporting our students and the community. I'm happy to spend some time, the next 5 minutes or so, to open the floor to you. If I can't answer your question now, I will certainly get you the information that you need, but I'm happy to entertain any questions you may have. Yes.
I know it's a loaded question, but are there enough SLPs in the area? Or if you double the program, are there jobs for that many?
We're always needed, yes. And I can just tell from personal experience from the increased traffic, I personally have been getting, we're hiring, we're needing even just personal networking or official recruiting calls, even to just me personally. I can tell that the need is definitely there. Yeah. And you can see from where we work and the kinds of services, unfortunately, it's job security, right? We work with humans who need us. And so there is always the need for quality SLPs. And there are other programs in the area as well. SLU has a program, Maryville, Fontbonne. So there are other master's programs in the area. But I think that was just the best person to do it. I just work with really great people. I'm happy to chat about them anytime.
Do you pick the clinical sites?
I'm sorry?
Do you pick the clinical sites? How do you get?
Yeah, I'm kind of like the sorting hat on Harry Potter. They can wish with their eyes closed, please send me here. But a lot of that depends on the availability of sites and supervisors, but it is a collaborative process. I do work with students to talk about their area of interest, but yes, it comes down to me assigning them a clinical rotation, but it's a more nuanced process, not a hard science, but I do work with them for that. Yeah. Yeah, if you know any SLPs who are willing to be site supervisors out there, let me know. I am in the market for them, for sure. Yeah.
So you mentioned brain injury. Do you have services that serve the veteran community at all, or is that part of your process?
Certainly anyone can come to us for services. We don't have outreach that's targeted specifically to that group. That's a wonderful idea. Certainly anybody can come to us to apply for enrollment. Children and adults. We're primarily a pediatric clinic, as you could see there, but we do have a handful of adults. One barrier is, frankly, to be honest, we are not Medicare providers. We're not credentialed. So that means that we can't bill for insurance. We're a private paid clinic, and that is a barrier on whom we can actually help. So to open up opportunities, even more opportunities for people who need us and for our students, that would be an investment idea in terms of looking to serve a wider variety of individuals who need us for those two purposes. Yeah.
How many patients do you see on campus?
So we tend to have each semester, we can float anywhere from 35 to 50 clients each. So we're small, but mighty. And part of the limitations of having a small program is you need more personnel, you need more space, to open that up to more. But that's currently what we have, because a lot of that depends on the enrollment for graduate clinicians. So if we have, like right now, we have 20 first-year grads. And so if I give them 2 clients each, that's what they need, because they have to also manage their graduate coursework. So it's a balancing act. And that's one reason our clientele is constrained.
Are the students paid for clinical work?
That is factored into their tuition costs for the university. At this point, their additional clinical fees on top of their general tuition is very minimal, lower than a lot of the other Illinois public institutions that are our primary competitors like ISU, Eastern. So the cost is quite low comparatively.
What is your clinical rotation schedule? Like,
I know people right. So our students go in their second year. Actually next week they're headed off to their first clinical rotation for 9 weeks. So that last half of the semester, in the fall, there's the first clinical rotation. And then there are 2 rotations back to back in the spring that are 8 to 9 weeks. And so those 3, that it follows that every year. So unless there's a pandemic, then we get really creative. I guess it was magic last year that we graduated. It's a miracle. Yes,
Have you seen that movie, The King's Speech?
I have. Don't
And
put marbles in your
Are all
mouth.
your patients as difficult as he was?
Our patients are wonderful.
Imagine-
Let's say challenging. And for students, it's good for them to work with people. They're working with people going through really difficult times. Some of you may have experienced communication difficulties in the past or know people who have. It's essential for our lives and the quality of our lives. So it's good for them to have challenge. But yes, we have some tough customers, but we're up for it. Yeah.
What percentage of your students end up working for one of their, from the employers in their rotation?
That is a really good question. I typically tell students not to bank on that. However, I've said that like, you probably won't be hired. And I say that, and I love it when they prove me wrong. We just had a student get signed at Barnes and their full-time SLP staff, and that is tough coming from Israel. They snatched her up for her clinical fellowship there, and that says a lot. So we do send students to all of those big hospitals, but our regional hospitals as well. So again, it's a variety of circumstances. I would say probably 3 or 4 of the 25 that graduated last year stayed within their school district or at one of their externship sites. But I cannot stress enough to them how important it is to network pre-professionally there. You never know when that connection will come back to be beneficial for future hires. And it's difficult for a clinical fellow to be hired into the NICU, for example. It's usually a winding path to get to those more complex sites. But that's a great question.
Any other questions for Jamie? Jamie, thank you for being here.